all Ghanaians must remember that the wearing of masks is now mandatory. Leaving our homes without a face mask or face covering on is an offense. Let me repeat, our survival is in our own hands. If we are lax and inattentive, we will continue to have serious challenges with the virus.
COVID-19, the new normal. In Ghana, the pandemic has hit too close for comfort. Over 26,000 confirmed cases and still counting. Over 130 people confirmed dead, with this number expected to rise. The government is at its wit's end as the country's coffers and health infrastructure reel under serious pressure. But behind these glaringly disturbing statistics is a silent hurdle.
I'm a bit worried about all of a sudden you see everybody selling these disposable masks all by the street side, and they say we should start thinking seriously about the disposal of these materials.
COVID-19 is increasing household waste as people continue to protect themselves and stay at home. But unfortunately, a lot of people are mixing all waste together. Now, the greatest concern for many in this period is the potential of infectious waste being littered and mixed with general waste in communities and households. Waste from personal protective equipment has become a growing problem as the wearing of nose masks, face shields, gloves, among others, becomes a common sight in countries across the world. Recent monitoring activities at the country's health facilities by a team of experts from the United Nations Development Programme, Health Facilities Regulatory Agency, HEFRA, and the Accra School of Hygiene to check waste segregation measures as well as other preventive protocols in the wake of the COVID-19 pandemic revealed disturbing state of affairs in some medical facilities.
Some facilities in Accra, for instance, sign on to this treatment facility where they transport their waste to be treated before disposal. But some facilities do not go through that technology. So you realize that some facilities, they just try to separate the waste at the source. That at the end of the day, they mix everything together at the temporary holding site. Then they sign on to a domestic waste management company to come and pick the waste to the landfill site, which is not safe for the environment and also for human health.
The major issue is the segregation or the separation at the generation point. So once we're generating, if it is bloody fluids with blood and other things, it should go into a different, and then other waste should also go into a different bin, so that it makes the incineration or the disposal or the management easier for the company. Critical staff that we expected to be in PPEs were not. Some were, but not everyone. The doctor usually maybe his assistant taking care of maybe those with emergency room, some of the nurses maybe. But we want to see every provider that comes to the emergency room or initial contact to have a PPE.
The issue of improper treatment of infectious waste at some health facilities comes at a time that over 2,000 of the country's frontline health workers have contracted the coronavirus, with some 4 doctors and 4 nurses dying as a result. Government is, however, yet to establish whether this was as a result of exposure to infectious waste. The Pwamang landfill site is one of the country's largest dump sites. used personal protective items from hospitals, factories, markets, households, and all walks of life end up here. Waste pickers rummage through mountains of filth for reusable materials despite the enormous health risks. Johnson Doe is the head of all the waste pickers here and has been in the business for 20 years.
This is how we work on our daily basis. And if you come here, normally every day when you come here, you see a lot of disposed PPEs that are from the factories, the hospitals, marketplaces, wherever. As now there is a campaign that you should dispose of your PPEs immediately. That is how we used to engage with the PPEs every day here. And as an organization or as an association, we try our best to isolate ourselves from those PPEs, but it's still out of hand that we cannot control much, because some you can't see them until you are scavenging. You are looking for your recyclable materials before you can see it, and it's too late. So these are some of the things that we are exposed to.
The number of COVID-19 patients being treated at home in Ghana continue to increase due to inadequate infrastructure. This means more medical wastes are generated every minute, adding to waste pickers' exposure. Johnson explains that they lack proper protective equipment to ward off any infections.
The major risks, especially when this COVID came, was how we are exposed to these PPEs that are already used, especially the hospital waste. And also the pins, let me say the hospital pins that are used for injection are sometimes disposed here. And also the dust that we inhale here, there are some of the liquid or hazardous liquids that we inhale you cannot see until you try to scavenge or hook, then you see the thing have exploded. The problem of the protective gears here is something we need to also dispose our protective gears every blessed day and wear another one. But it's something that we cannot afford. One, nobody is providing for us.
Medical waste tutor at the Accra School of Hygiene, Michael Affordofe, points out that more urgent steps are needed to avert a new wave of infection.
The World Health Organization made us understand that the waste from COVID-19 patients are infectious waste. And because they are infectious waste, it is likely that the virus can be transmitted through the waste to a susceptible person. Because of that, the waste needs to be treated before disposal. That is why we are advocating for the treatment of the waste. So if this is not done, then it is likely that whoever may come in contact with the waste, either at the landfill site, or either at the disposal site, or even during collection and transportation, whoever will come in contact with the waste is likely to be infected with the virus.
Waste pickers and informal environmental workers in general are often confronted with the niggling question of whether to protect themselves from coronavirus by refraining from work and possibly face starvation, or work and be extremely exposed to the virus. 44-year-old Grace Avemegah is a mother of 3, and she is in such a dilemma. She fears she might contract the virus at the dump site, lamenting successive government neglect of waste pickers.
The work we are doing is the dirty work. The virus too, they like dirt. The moment the waste is touching your body, the virus too, it can affect you. The situation that we are right now is very serious for us. So here, water to wash our hands is very important. We are not getting any help from the government. We are trying our best to support ourselves, but get a help from the government that, or this is what came from the government that we should use to protect ourselves there. No, we are not getting anything from the government.
Acting Executive Director at the country's Environmental Protection Agency, John Pwamang, believes it is time to pay critical attention to waste management amid the COVID-19 pandemic to ensure that people are not put at risk of contracting the virus from infectious waste.
They don't collect it properly. They don't also contain it well when they are moving. Sometimes you see that it is open and some are flying off, and the people themselves are not also well protected, to be able to do that work. And then when they carry it, many times they don't take it to the right place for disposal. Sometimes it ends up in, unauthorized places. So there is a very serious challenge there, and this has to be a very serious program that we need to have, because they are providing a very good service, because they are able to enter corners where big trucks cannot go, which is good. But then we need to go further, to try to control the way they do the work.
The EPA boss is also concerned that the country's shorelines are now littered with discarded protective items.
Now many of the fish, fishermen are catching plastics instead of fish, and it's caused a lot of problems. There are, projections that if we continue this way, by in the next 50 years we'll get nothing in the oceans apart from plastics. The fish will not be, will not be there anymore. So these are projections that are there. And also now we have got the problem of microplastics. Plastics over time, they break up into small pieces, even though they don't degrade per se, but they break up into small pieces which find their way into the food chain. They get into the fish. Some of them are also getting into water and so forth. We get into our bodies, and it's creating a lot of health problems for us.
I sought to get some answers at the corridors of power. Dr. Insiasari is Ghana's presidential advisor on health.
For the general public, it needs education. You see, waste disposal. It's not. We've realized that people who are doing it are people who are not educated. We have to talk. We are going to engage the Ministry of Sanitation to talk to them about the health hazards of those who are handling our waste. As you rightly said, at the pond disposal site, you saw all this. There are people who are supposed to, who are handling it over there. Those who are doing it of tricycles and this thing should be well protected. If for nothing at all, they should wear heavy gloves, where the needles and syringes are not supposed to be disposed at that site. They are supposed to be kept in the hospital and well disposed, other means of incineration and other things.
According to the World Health Organization, it is estimated that 89 million medical masks are needed globally every month while the coronavirus pandemic lasts. This means urgent action across the board is needed to prevent health hazards and long-term environmental risks.
The more I read and find about this virus, the more I personally get scared. So where are we going to be as a nation and as a people? So this is on hands on deck approach.
All of us, our lives are in our own hands, and that if we misbehave, as we sometimes like to do in this country, then we are putting ourselves at risk.
Infectious waste have to be segregated, well segregated, and not mixed of general waste.
Especially the waste pickers. They must first of all be in the requisite PPEs. And the PPEs that should be used by waste pickers should be different from that will be used by maybe a doctor or a nurse. They are supposed to use utility gloves or heavy duty gloves. They are supposed to make sure they are in a gown and even an apron, wear a goggle, and wear even a boot. That way, even if you come in contact with the material, it will not infect you.
We are also frontliners, and in some advanced countries, waste pickers are being like an essential service to the nation. And here, we have tried to fight for this recognition for a long time. Thank the Almighty that COVID came, although it's something that we are all running off. But God has revealed that it's now like a touch for everybody to see that how we are suffering here.
Reporting for GHOneNews, Ridwan Karim Dini-Osman, Accra.